Do you qualify for a GLP-1 agonist if you've had metabolic and bariatric surgery, or if you're planning one in the future? We're going to talk about that today. My name is Dr. Lindsay Ogle, and I'm a board-certified obesity medicine physician. And this is something that has come up quite a bit in my practice for individuals who come for support after they've regained weight after having a metabolic and bariatric surgery in the past. Or maybe they are considering which option is best for them. Should they pursue surgery or pursue an obesity management medication? Or maybe they are considering a combination approach, or that might be what my recommendation is for them. And we're going to talk about why those cases might be and what are some of the things to watch out for and be aware of when pursuing these treatment options. So first, we'll talk about using a GLP-1 medication prior to metabolic and bariatric surgery. This could be a great option for somebody who has an elevated BMI in the class 3 category, so it's a BMI of 40 or greater, and specifically individuals with a even higher BMI of maybe 50 or greater. And especially if they have a lot of metabolic comorbidities, maybe diabetes or insulin resistance, obstructive sleep apnea, potentially some cardiovascular disease. If they have metabolic dysfunction associated steatotic liver disease or fatty liver disease, what is commonly called, these individuals would likely benefit from optimization prior to their surgery. So utilizing a GLP-1 medication to help get some weight off, as well as control of their weight-related conditions and metabolic conditions. And the GLP-1 medication can help achieve that. But for most people with that elevated BMI, they are not going to reach their ultimate goals, whether that's personal goals or health goals, with a GLP-1 medication alone. And so once they are optimized on their GLP-1, or maybe prior even to that, then they are a safer candidate for metabolic and bariatric surgery and have less perioperative surgical risk. So the surgery is safer for them and more likely to have a positive outcome. So that's a great option for those individuals. The thing to note with utilizing a GLP-1 around the time of a planned surgery is that most surgeons and anesthesiologists will want you to hold your GLP-1 about a week prior to that surgery. And that's to decrease the risk of aspiration when you are under anesthesia. So that's pretty common. And if you're having a different surgery, you could start immediately after your surgery if you're feeling well. But of course, talk to your doctor about that, what timing might be best for you. But for metabolic and bariatric surgery, because of the significant changes to the GI system, it is typically not going to be something that you restart right away. This is something that is being studied, and there may be certain patient populations where this may be recommended either now or in the future, but I think most clinicians would recommend holding off on a GLP-1 after metabolic and bariatric surgery for at least a year or two as the body is recovering. That's usually when we see the most weight loss related to the surgery. And then we can see where things kind of settle out in the body, both from a weight standpoint and then a hunger signal and metabolic standpoint. And we can make a more informed and safer decision on if that individual would need or benefit from a GLP-1 agonist after their metabolic and bariatric surgery. If the decision is to start a GLP-1 medication after surgery, again, we'll wait for the vast majority of people about a year or two to have that evaluation. Prior to starting, we want to make sure that your nutrition and your micronutrient levels are optimized. You should already be on your bariatric supplement and potentially other supplements depending on the surgery and your baseline labs. But this is something that needs to be checked before starting a GLP-1 agonist or any obesity management medication. This is something that anybody with metabolic and bariatric surgery should be having checked at least annually. It's very important to have these labs done because it could do quite a bit of damage if these micronutrients are not at the recommended levels. So this needs to be monitored prior to starting a medication and periodically while on the medication. Again, at least once a year, maybe more frequent in that combination of surgery and medication population. There is a wonderful supplement company that I have been working with and getting to know. They're called ProCare. This is an independent supplement company. They are third-party tested, meaning that there is a different company that tests their product to ensure that it has what it says that it has in its products. And they also consult other health professionals and scientists. So they consult doctors and registered dietitians and scientists to make sure that they are having quality products that they are recommending to their customers. And because I believe in them as a company and trust their products, I have decided to accept their offer for a discount code. So anybody who uses the code Metabolic Health will get a 10% discount on their products, and I'll have that linked below so you can check it out and see if it's something that you would want to incorporate. Whether you've had metabolic and bariatric surgery, that's their specialty, but they also are supporting individuals who are on GLP-1 agonists, and there's other products that really anybody could benefit from. But going back to starting a GLP-1 after surgery, when choosing a GLP-1, there is something really important to consider. It is the absorption of that medication. And because the GI tract is altered during metabolic and bariatric surgery, it is recommended to utilize the subcutaneous injectable GLP-1s because that's not going to affect your absorption of the medication. It's going to be the same whether you've had surgery or not. If you've had surgery, then we really need to closely monitor how you're responding if you do choose an oral option. If we're thinking about oral Wegovy, that's absorbed in the stomach. And so for anybody who had a surgery that makes the stomach smaller, so that is truly all of the surgeries. So sleeve gastrectomy and bypass are the most common. Then there may be decreased absorption of the oral Wegovy. Again, injectable Wegovy, same effectiveness, same absorption. Oral Wegovy, if that's the only option you have, you could always try it. It's not harmful. You just may not have optimal absorption. So you really want to closely monitor your response to that medication. And then our other option, oral Foundayo, this medication is absorbed in the small intestines. So anybody who had the sleeve gastrectomy or gastric sleeve, you'll probably absorb this just like anybody else. But if you've had gastric bypass or a SADE is another surgery that decreases the absorption, then you may want to reconsider oral Foundayo. Again, if it's your only option, you could absolutely try it. But again, closely monitor your response to the medication. And if you're not seeing any of those benefits when you get to the higher doses, then you're probably not absorbing it and it's probably not the best medication for you. If you did choose a GLP-1 medication and you're starting it about a year or so after your surgery, it is so important that you titrate slowly. And I always recommend, and I'm an advocate for, slow titration of GLP-1s. I just see that patients tolerate it better, have better long-term outcomes, and are able to reach their goals at lower doses overall. But especially in anyone who has had a bariatric surgery, we need to go slow with these medications to avoid the side effects and to prevent excessive appetite suppression and excessive satiation with meals, that excessive fullness that would really make it difficult to reach adequate nutrition when you're combining the metabolic and bariatric surgery with a GLP-1. Both of them commonly have GI side effects, and both of them make you feel really full on less food, which could put you, with that combination, could put you at risk for severe side effects and poor nutrition, which could lead to many complications like muscle mass loss, fatigue, micronutrient deficiencies, hair loss. The list goes on and on. So we don't want that for anybody. We never want to, give up our health for a smaller body. That is not the goal of obesity medicine. The goal of obesity medicine is to manage weight, to improve weight-related health conditions, and to improve quality of life and longevity of life. And you're not going to get that if you're not nourishing your body adequately. And that brings us back to the importance of monitoring micronutrients and dietary intake. So utilizing a registered dietitian is a great idea in this population. And they're great for anyone who has had metabolic and bariatric surgery or is utilizing an obesity management medication, but definitely beneficial when you're combining those two. If you don't have access to a dietitian, sharing your nutrition patterns and the things that you're eating with your prescriber is very important, so they know if you are reaching your protein, fiber, and just overall caloric goals. And then you need to have your labs checked regularly. I'm saying this again because it is so important. And I don't think that a lot of the massive telehealth companies that prescribe GLP-1 medications are really monitoring this. So this is something that you may have to advocate for, or specifically seek out the support of an obesity medicine physician. And last, I do want to remind us all of the non-GLP-1 obesity management medications, our first generation medications. I recently did a talk about these that I will link here, but these may be a better choice for individuals who have had metabolic and bariatric surgery because they work more at the brain level and helping control appetite and cravings, but they do not impact the slowing of the stomach. And that's positive in this population because it can limit the GI side effects and it can limit the excessive fullness that the combination of surgery and GLP-1 medications can induce. So that's something to consider potentially trying first, or if you had tried a GLP-1 and it was too strong of an effect along with your surgical history. So I hope you found this helpful. I hope it highlights the fact that treatment should truly be individualized to what is best for you because you have unique risk factors, you have unique conditions and other medications that we need to consider. And we are getting more and more options available for treatments to really continue to individualize. And many people do need a combination treatment. And that does not mean that there is anything wrong with you or you're doing anything wrong. It's how we manage most of the chronic medical conditions that we treat, especially in primary care and in the medical field in general. If you think this would help anybody that you love, please share it with them. And I can't wait to see you next week for our next topic.